Hello everyone, I'm Dr. Motahare and welcome back to the Art of Medicine. In this episode, we will talk about gallstones and biliary colic. We will explore the definition, the symptoms, diagnosis, and also treatment options. Let's dive in. I'd like to start with bile journey. As you know, liver is a very vital organ in the body that processes nutrients, detoxifies harmful substances, produce different types of proteins, and play a central role in metabolism. One of its key functions is producing bile, which is essential for fat digestion. This bile is made by liver cells from cholesterol, bile salts, and waste products like bilirubin. It flows through small bile ducts that join together to form common hepatic duct, which carries bile either directly to the intestine or stored in the gallbladder. So what is gallbladder? Gallbladder is a small sac under the liver that stores and concentrates bile. When we eat fatty food, it contracts and releases bile into the small intestine, helping break down fats for digestion. So what are gallbladder stones or cholelithiasis? These are solid deposits formed from cholesterol, bile salt, and bilirubin inside the gallbladder. And what is biliary colic? Biliary colic is a type of pain that is a steady pain that is caused by temporary blockage of bile duct. Temporary blockage lead to this kind of pain. While many stones remain silent, symptoms appear when they obstruct bile flow. Gallstones are common worldwide, especially in the developed countries. They affect around 10 to 15% of adults. Women are affected more than men, especially during reproductive years because of hormonal effects. Prevalence increases with age. Certain populations like Native Americans and Hispanic have a much higher risk due to genetic and also dietary factors. In many people, gallstones remain silent, but about 20% will develop symptoms in their lifetime. So why these stones are formed? Gallstones form when bile components become imbalanced, often too much cholesterol or bilirubin, or too little bile salts. This leads to precipitation of crystals which grow into stones. A stasis of bile, such as from fasting or reduced gallbladder motility, also contributes. What are the risk factors? As I told you, women are more prone than men. The risk rises with age, especially after 40. Obesity, metabolic syndrome, and rapid weight loss can all promote cholesterol supersaturation in bile. Pregnancy and high-fat, low-fiber diets also contributes. A family history of gallstone is also important as a genetic susceptibility. Certain medication can lead to gallstone too, and also, as I mentioned before too, finally, ethic plays a role. Native American and Hispanic population are some of the highest rate of gallstones globally. If there is a blockage in the biliary system due to some stones, the following symptoms can be appear. First, the kind of pain which can be so severe in the right upper quadrant of abdomen or central upper part of abdomen that can be radiated to the right shoulder or back. Also can be with nausea, vomiting, or bloating. It usually started suddenly after a heavy fatty meal. Fatty meal. It can last between 30 minutes to several hours. The pain is steady. All the time there's a pain in that period of blockage. And pain subsides once the gallstone is successfully passed. But the soreness of the abdomen may persist for around 24 hours after the worst of the pain passes. About differential diagnosis, biliary colic has a very distinct pain pattern. Right upper quadrant or central abdominal pain, radiated to the right shoulder or back, triggered by fatty meals and lasting from 30 minutes to a few hours. The pain is steady, not intermittent, and doesn't improve with bowel movement, position change, and antacids. When there is gastric ulcers, usually there is a burning sensation that responds to acid-lowering medication. Gastroesophageal reflux produces heartburn, often worse when lying down. Pancreatitis pain is very more severe, that radiates straightly to the back. And also the position change the intensity of the pain. And again, lab tests are different. IBS or irritable bowel syndrome causes crampy pain with changes in the bowel habits. And pain typically eases after passing stool. Episodes of biliary colic are generally intermittent, and sufferers may experience several weeks or months without an attack before experiencing it again. Recognizing these differences help avoid misdiagnosis. Key steps in diagnosis are history and physical exam, ultrasound, abdominal ultrasound as a first-line imaging, blood tests such as CBC, liver function test, bilirubin, and inflammatory markers. And if there is a need for more detail, we can use CT scan or MRCP. In MRCP, we can visualize the biliary tract completely. And if there are also other possibilities based on our differential diagnosis, we will do anything that is needed. Gallstones can sometimes lead to a variety of complications. The most common is acute cholecystitis, an inflammation of gallbladder often caused by persistent blockage and bile buildup in the gallbladder. There will be pressure on the wall, gallbladder wall, that can lead to inflammation and sometimes infection. The symptoms are, again, sudden right upper abdominal pain, nausea, vomiting, fever. The patient is not well in this when there is cholecystitis. If acute cholecystitis is left untreated, it can result to more serious complications, such as gallbladder rupture or infection. If stones move more distally to common bile duct, it can cause block the bile flow, can cause cholangitis, which is really a life-threatening infection. Stones can also block the pancreatic duct because the biliary duct and also pancreatic duct at the end will join together. And this stone can block the pancreatic duct too and can trigger gallstone pancreatitis, which can be very severe too. For treatment during an acute attack, we just use pain relief with NSAID or opioid based on patient need, and antiemetics for nausea. But the definite management is laparoscopic cholecystectomy, which is gold standard. If the stones are moving to bile duct, maybe we should use some other modalities such as ERCP to remove that stone. And in very rare cases that the patient cannot tolerate surgery, patient is non-surgical case, maybe some kind of therapy will be used to dissolve that stones. But it's not clear whether surgery is indicated for everyone with biliary colic or not. This is not clear yet. It should be concluded based on every patient's situation separately. There is no written protocol for everyone. About diet. Diet is important both before and after treatment. If someone has biliary colic, a low-fat diet can reduce the frequency of pain attack. After surgery, just start with low-fat meals and slowly return to normal fat. Avoid large greasy meals early on. But after that, after a few weeks, you can completely return to your previous diet. No limitation. But as a common recommendation, fresh foods, vegetables, lean proteins, and whole grains should be considered in our diet, and also drink enough water every day. Thank you so much for joining me today. If it was helpful, please subscribe, like, and share so more people can learn about these common and treatable conditions. I'm Dr. Motahare. See you in the next video. Stay informed, stay healthy.